We're starting with a sobering situation. You see a lot of red on this map. In the last hour, Johns Hopkins University reporting that the United States is now the leader in the world for confirmed coronavirus cases. These numbers you see here are new at 6 o'clock. More than 82,000 infections in our country, and the deaths, those are nearing 1,200. With 237 new deaths reported just today, this is the deadliest day so far in the outbreak. We do want to thank you for being here with us tonight. I'm Samantha Jones.
I'm Steve Savard, continuing to work from home. Tonight, we have new coronavirus case numbers for both Missouri and Illinois. Missouri is reporting 146 new cases today, 502 total. It's a 40% increase from yesterday as more people get tested in the state, and there are now 9 deaths in Missouri. Illinois numbers jumped, 673 new cases today, bringing the total to more than 2,500. There are now 26 deaths reported in Illinois. And in the past 30 minutes, St. Louis County has released new numbers. A woman in her 80s has died today of COVID-19. That is the second death in St. Louis County. There are now more than 140 positive cases in the county. We start our team coverage tonight at 6 in the Metro East. Alexis Zotos is following the activation of National Guardsmen to help with the pandemic.
Steve, in the last hour, soldiers from the National Guard from here in East St. Louis headed to central Illinois. They packed up and they are on their way to help distribute much needed medical supplies. Take a look. You can see them heading out just within the last hour here in the Metro East. It was roughly 50 soldiers from the 1844th Transportation Company that were called up as part of the statewide response to the coronavirus outbreak. These soldiers will join about 200 others across the state as Illinois deals with a major jump in cases today. These are volunteers, and they'll be deployed to different warehouses across central Illinois where they'll be distributing much needed medical supplies.
These soldiers are your neighbors, they're your coworkers, you know, they're just people just like you are, and they just want to do that little bit of extra. They made a commitment and they're out here to help, and that's what it matters. It's just helping, doing the best that we can.
So she told us that this group of soldiers, they have been activated before for flooding. She's also been activated for ice storm, but this is something much different than some of the responses they've had to Mother Nature, and they have a lot of work ahead of them. Reporting live in the Metro East, Alexis Zotos, News 4.
Alexis, thank you. Forced to wear masks for days in a row. Tonight, employees at Bell Fountain Rehabilitation Center say they're concerned for their health. Just days ago, an employee there tested positive for the coronavirus. The state-run mental health facility is located near Bell Fountain Road and Highway 367. News 4's Emma Hogue is investigating tonight.
Tonight, the county executive's office tells us this is the first they've heard of this issue and that it does not meet best practice guidelines. Right now, they are actively looking into getting these employees more supplies like masks. But until then, employees tell me they don't feel safe going to work.
One mask for 3 days. It has to be signed in and out. They want you to place it in a brown paper bag.
A new reality for employees at the Bell Fountain Rehabilitation Center. This employee, who wanted to remain anonymous, is concerned for the health of residents and other staff.
You're just recontaminating everything by placing it in this bag with a whole box full of other bags, so people have to go through, touch the bag, and rummage through the bags to find their bag just to put it on your face.
According to this letter, Tuesday, another staff member tested positive for COVID-19. That person was last on campus March 14th. The notice urges employees not to call the health department, but instead says they'll be notified individually if they're at risk.
The way that our campus is set up, everybody comes in contact with everybody.
Hello, you have reached Bell Fountain Rehabilitation Center.
Today, I called the Bell Fountain Rehabilitation Center asking about the lack of transparency and overuse of the same masks.
I can give you her email address.
They told me someone would respond via email, but I'm still waiting to hear back.
They're just not providing us with enough information, and it's causing staff to be scared.
Now, a lot of viewers in different work environments have contacted us regarding exposure concerns. The county tells me anyone who comes into contact with someone who has COVID-19 should self-quarantine for at least 2 weeks. Right now, the county tells me they are working with the Bell Fountain Habilitation Center to find out which employees need to do that. Reporting in Clayton, Emma Hogue, News 4.
Late this afternoon, we were contacted by the state's Director of Health and Senior Services saying there was no additional actions required by the Bell Fountain Habilitation Center. The director went on to say the facility began sanitizing months ago and is following proper guidelines regarding mask shortages. Tomorrow, the White House is expected to pass a $2 trillion stimulus package addressing the coronavirus pandemic. When the bill becomes law, money will start flowing quickly. Small business loans can convert to grants. They'll be turned around within 36 hours for some businesses. Unemployment insurance will go up by $600 as soon as next week. And $1,200 cash payments to individuals, well, those could be directly deposited within the next 3 weeks. And that money will be much needed relief for people who now find themselves jobless. A record-breaking 3.3 million Americans filed for unemployment benefits last week. In Missouri, claims last week topped 42,000, Illinois 115,000. In Missouri the week before that, there were only around 3,900 applications submitted.
News 4 is asking major healthcare providers where they stand on staffing and equipment. Mercy Hospital tells us right now they have fewer patients overall than they had during the winter months. They have enough supplies, they tell us, but are trying to stock up on what may be in demand in the future. SSM Health says they have enough staff and there are open patient beds throughout the region. The hospital adds they've been working on a plan to fight the spread of coronavirus since December.
For the first time, I am unable to get my prescription filled here locally.
Patients with arthritis and lupus are struggling to find their medicine. It's because the drug is now a potential treatment for coronavirus. Russell Kinsall spoke to a woman who used the drug for decades and is now dealing with the shortage. She's live for us in Troy tonight.
Well, right now, pharmacies are seeing panic cause prescriptions of hydroxychloroquine to skyrocket. People who have taken the drug for years say it's almost miraculous at how it's prevented them from getting colds and the flu. But the reason they take it is because they suffer from chronic illnesses, and now they can't find their medication.
I was prescribed this medication about 26 years ago, and I've been on it ever since.
Chris Engler takes hydroxychloroquine to treat lupus and rheumatoid arthritis. She understands why it could show promise to treat the coronavirus.
I still have symptoms with the autoimmune disease itself, but after being on this for 26 years, I had never experienced flu or a cold.
There have been anecdotal reports of the medication being an effective treatment for coronavirus in conjunction with other medications. There haven't been any studies to prove that, but that hasn't stopped doctors from prescribing it or hoarding supplies.
For the first time, I am unable to get my prescription filled here locally, and also I've checked out at other towns and unable to get it filled.
Hydroxychloroquine has been used to treat and prevent malaria for decades, but it's also approved for treatment for lupus and arthritis. A shortage in supplies could have significant repercussions for people with these chronic illnesses.
I just wanted to make people aware that there are people that are depending on this medication for their pre-existing conditions.
Other countries have started clinical trials of hydroxychloroquine to see its benefits for being given before and after they're infected with the coronavirus. Clinical trials here in the United States have not started yet. Live in Troy, Missouri, Russell Kinsall, News 4.
Infectious disease experts are monitoring closely the spread of coronavirus in hard-hit cities like New York and now New Orleans, and it's only natural to wonder how bad it may get here in St. Louis.
News 4 investigator Lauren Traeger has been asking a number of local leaders that very question. She's in West St. Louis County tonight.
A number of officials tell me today they are in the very early stages of trying to build some prediction models. You've heard the term flatten the curve. Well, what exactly could the curve look like for us here in this region? Best and worst case scenarios for the number of people getting sick, needing hospitalization, and also ultimately dying. A number of people I talked to today said that really depends on you.
New York is scaring us. The trend there is exponential. in both cases that they're finding and deaths.
Pam Walker used to head health and emergency response departments in our area.
I've never seen anything like what is happening in New York.
But how will the virus impact us?
We don't have good data yet on who's going to get the sickest and who's going to die.
I called around to local and state health officials. The state of Missouri says modeling isn't yet available. Not a surprise to Walker because of a lack of testing.
We can't just assume that St. Louis is going to be like Italy or China. We can't just assume that. America's different. So we're not going to have solid projections and be able to make decisions about opening things back up until we get more people tested and we have that surveillance data.
Sources tell News 4 the St. Louis County Council, though, has been briefed to expect cases to double every 3 days, with a possible total of 200,000 people infected, about 20% of the total population in St. Louis County. If hospitalization trends from New York continue, that could mean close to 30,000 people hospitalized.
I don't know if that's right or not. You know, until we get better testing, I'm not going to guess.
Walker says it's really still all so new.
This is a disease we don't have 100 years of experience with.
Since we don't have projections, we don't have models, is it best to just assume the worst?
It's best to assume that the worst will happen if we don't put restrictions in place.
Dave Dillon with the Missouri Hospital Association says his organization will soon be working with the state of Missouri to gather data for prediction models.
We're absolutely planning for it because we would be practicing, malpractice. It'd be malpractice not to plan for it.
But he shares Walker's opinion. The biggest variable is you.
People, please take it seriously. Protect yourself, protect your family, and stay home and social distance.
St. Louis City Mayor Lyda Crewson today said they also expect their cases to double about every 3 days or so. When we talked to her today, she did confirm there are cases in every zip code in the city. Certainly, we will continue to request the reports and the data on this issue. We'll bring it to you as soon as we have it. Reporting in West St. Louis County, Lauren Traeger, News 4.